San Diego veterans are doing what they can to help rescue Afghan allies. ABC 10 News reporter Rachel Bianco tells us about the Army vet who says there are a couple of things the U.S. can do to speed up evacuations.
His name was Aleem Shah.
Everybody has their Aleem Shah.
Dan Wilson is a retired lieutenant colonel in the Army. Shah was his partnered Afghan battalion commander. But to Wilson, Shah was so much more than his title.
Everybody had that person that kind of showed them that we're not so much different from each other, even though we're culturally vastly different.
Wilson can share Shah's picture because he is not hiding from the Taliban. He was killed in 2013 by an explosive device. The San Diego vet, now part of a virtual army, doing everything they can to help get other Afghan allies to safety.
We need to be truthful with them and just to keep repeating, we're going to get as many people out as possible. What an Afghan hears out of that is, that means me, and that means now. And it's just creating conditions that are making it more dangerous for our people on the ground.
Wilson believes the State Department needs to make it easier for people to get their special immigrant visa and make it more clear who is eligible rather than having everyone crush the airport.
We're not helping them by not telling the Afghans, hey, look, if you are not an American citizen, green card holder, or a Civ candidate, we're not going to let you in, so go to somewhere safe.
Wilson is calling on lawmakers to lean on vets like himself to help with the applications.
I get it. I'm like, the State Department has a system, but this is extraordinary times and calls for extraordinary, out-of-the-box, creative solutions.
A solution Wilson hopes to be a part of for Shah and all of the Afghan faces he can't show because they are in hiding for their lives. Rachel Bianco, ABC 10 News.
Keep track of new developments with our ABC 10 News mobile app. We will send push alerts right to your phone. Just search 10 News in the App Store.
Now to the pandemic. Major news on the vaccine front as the FDA did grant full approval to the Pfizer vaccine. As ABC's Morgan Norwood reports, the federal government hopes more people will now get the shot.
As the Delta variant rages, the FDA granting full approval of the Pfizer COVID vaccine for those 16 and older, making it the first to be fully licensed in the U.S.
This is a pivotal moment for our country in the fight against the pandemic.
The approval comes as more than 80 million eligible Americans are still unvaccinated. 31% of those who haven't gotten the shot say they would if it's approved by the FDA. Pfizer releasing a statement saying the public can be confident that this vaccine meets the FDA's gold standard for safety.
By following our rigorous processes to evaluate this application, we hope those who have waited until now to make the choice to protect themselves and thereby also help protect their communities by reducing the spread of COVID-19 will go and get vaccinated.
With the FDA backing the vaccine, businesses, school districts, and government agencies now have even more legal cover to require vaccinations. The Pentagon immediately announcing it will press ahead with plans to require members of the military to get their shots. New York City mandating vaccines for teachers and school staff.
This is a game-changing moment. We've been waiting for this for a long time to have the full approval of vaccine. We now have it. This helps us move forward, and we're moving forward with our schools with this new vaccine mandate.
President Biden celebrating the approval and commissioning more companies, agencies, and school districts to require vaccines.
Require your employees to get vaccinated or face strict requirements. And as I said last week, vaccination requirements have been around for decades.
And the Biden administration is considering a plan for booster shots for Americans starting September 20th. The CDC is set to discuss booster shots on Tuesday. Morgan Norwood, ABC News, Los Angeles.
San Diego County Chairman Nathan Fletcher responded to the news saying the COVID-19 vaccines are safe, effective, and free. Today, the U.S. Food and Drug Administration reinforced it by granting Pfizer its full approval. To protect our community, we need all San Diegans to get vaccinated.
A new study out of Israel found a Pfizer booster shot significantly improves protection for those 60 and older from COVID infections and serious illness. The country's health ministry says people in that age group who got the third jab were 4 times more protected than those who got 2 doses. Protection from serious cases and hospitalization was 5 to 6 times higher. Israel was the first country to approve booster shots. The U.S. plans to start giving boosters out to the general public in September. Many San Diegans are still coping with symptoms weeks or even months after having COVID. They're known as long haulers. And today on ABC 10 News at 11 o'clock, Kathleen Kennedy from Sharp told us that they've been learning how to treat those symptoms. However, no 2 cases are exactly the same.
We're seeing so many different scenarios. Certainly, we are seeing all of the patients that were in the hospital for a long time, possibly on ECMO, maybe on a ventilator. But we are seeing just as many who maybe were never in the hospital, went to the emergency room a couple times, and just really had a difficult time. We're also seeing some people that probably had COVID, but maybe weren't tested.
And while research is being done, there is still no way to know who is likely to have long-haul COVID symptoms or what causes them.
As COVID cases and hospitalizations climb, there is concern that hospitals in our area will have to turn away non-COVID patients from their ICUs. The COVID case count has doubled, and at times it has tripled just compared to last month. In the same period, the percentage of positive cases went up about 4%. Infectious disease specialist Dr. Christian Raymer says the county is having a difficult time keeping staff employed.
Something called moral trauma or moral injury. And we go into this field because we care about people, we want to take care of people, but the way that healthcare workers